lower back or leg pain worse first thing in the morning? Bending over to put on your shoes or put on your socks, maybe bending over to brush your teeth in the morning causes you intense lower back or leg pain. What about prolonged sitting? Is that aggravating to your back or leg pain? Do you get pain as you transition from sitting into the standing position? If you answered yes to all or some of those questions, then you very likely may have a flexion intolerant lower back. If you answered no to those questions, then you probably need to look at elsewhere, because these exercises may not do a lot of good for you. But if you have that flexion intolerant lower back, I want you to find a safe place to lie down. You're just gonna lie down on your stomach. So you're gonna start here. Don't judge yet on how that may feel. And then what you're gonna do is you're just gonna slowly work yourself up onto your elbows. Now that might be slightly uncomfortable at first. Maybe you haven't been in this position for a while. You kind of get an increase in your lower back. What I want you to focus on is just trying to wiggle your lower back and your butt a little bit, just to kind of relax those tissues down there. You should just kind of let your belly hang, kind of hanging out in this position. Focus on breathing into your belly. And as you lie there a little bit more, I want you to take note of how your lower back or leg pain is feeling. Is it getting a little bit better? Maybe you no longer feel the pain quite as far down your leg as you did at the beginning. Maybe your back pain is getting slightly worse, but your leg is getting better. I just want you to hang out here for a few minutes, and then we're going to kind of monitor our symptoms after we get out of this position. So fast forward here, you can pause the video. I want you to kind of stay in this position for a few minutes, and then what we're going to do is we're just going to kind of make our way to our stomach. We're going to kind of roll to our side, and then we're going to take our time and we're going to kind of sit up in this position. We're going to stay really, really tall. And if you feel after 3 minutes or so on your stomach in a slightly extended position, if you feel relief of your lower back or your leg symptoms, then that is going to be a really great exercise for you. We'll show you some additional movements that you can perform to treat this yourself, as well as some spine sparing movements to limit the amount of flexion in your lumbar spine to allow this time to heal. You may have a disc injury. We wouldn't be able to tell without a proper evaluation in the clinic, but put that aside, as we're able to treat this without any fancy MRIs and with just some exercise in a lot of cases. So what I want you to think about is that humans in general flex their spine much more frequently than they extend it. And a lot of times when we have an injury, flexion is a movement that becomes provocative or aggravating. So to get through that injury, we need to move the spine in a different direction. We need to avoid that lumbar flexion, all that bending. We need to kind of put a bandage on it, kind of maintain an upright position, and then continue to move in the direction of extension to allow that disc to heal and kind of create an environment for healing. So that's something to think about. If you have a flexion intolerant lumbar spine, you're going to want to be in extension. You can start prone on elbows. That exercise is called. You're just going to be there for a few minutes, and then we can transition into a little bit more intense exercise from there in what's called a press up. So what a press up looks like, it's the same position. So you're going to start here, right, prone on elbows, and then you're going to nice and easy put your hands underneath you like you're going to do a push-up. But instead of putting your feet on the ground, you're just going to push your upper body up, and you're going to let your hips stay on the ground. Now you may not be able to get your arms straight at first, but I just want you to kind of go to where you feel that pain and then come back down. Kind of monitor your symptoms. Maybe you get pain at the top, and then those symptoms kind of go away as you go back flat. That's a really good sign, and we're going to nice and easy just kind of work into that movement. So what we're going to do is we're going to slowly do 10 of these. We're just going to nice and easy press ourselves up, kind of find our barrier, and then go back down. We're going to monitor our symptoms. What happens in the lower back? What happens in the leg? Ideally, we want to see an improvement in our range of motion as well as our pain as we nice and easy move our lumbar spine into extension. Once you do 10, I want you to just kind of rest back in this prone on elbows position, and we're going to kind of let things calm down. Maybe we had a little bit of aggravation with that, and then we're going to monitor our symptoms at this point. So the important thing to think about is now we want to monitor our symptoms rather than necessarily during the exercise. So now, is our leg pain still all the way down our leg? Maybe it's just in our buttock. Maybe our back pain is a lot better. Maybe our butt is a lot better. So we want to monitor the improvement in symptoms as well as our range of motion. So With a flexion intolerant low back, we want to see how it responds to extension forces. And this is an extension force of the lumbar spine that's very, very safe and effective. So I want you to try that out. You're going to start with a 3-minute test where you just kind of rest yourself on your elbows. If you get relief from that position in your lower back or your leg, you're going to slowly transition up into what are called press-ups. And then we will have another video with some spine sparing movements showing you how to sit at your desk, transition from your car and out of your car, transition from a sitting to a standing position, rolling over in bed. We're going to show you how to do all those movements in a very safe and effective way to kind of take the stress off your lower back. So I want you to try those exercises and continue to follow along, and we'll get through this flexion intolerant lower back together.